Hello, everybody. This is Lisa Lanasa, joined with Allison Herschede, and we are going to be talking about female hormones and our monthly cycles and blood sugar control. So we are so happy to be joining you today, whether you are joining us live or whether you are watching this video once it's posted on the diaVerge Facebook page. We have so much to talk about, and this was actually a really interesting topic to be researching, wasn't it, Allison?
Oh, yeah.
So, it boils down to we can see what's happening with our bodies a little bit more with low carb. I was saying you can kind of see the forest through the trees, finally, where you can see what's causing some of these blood sugar fluctuations. So I'm sure most people are.
Lot more.
True. But I'd suggest, or maybe say, that most people are probably like me, where your blood sugar is going great, everything is going smoothly, you have great lines on your CGM, and then all of a sudden your blood sugar levels go up, and there's nothing to really explain it otherwise, and you have no idea what's happening. You make the appropriate corrections, and then all of a sudden, as fast as it was there, it's gone again. And okay, so maybe you don't have to imagine that. Maybe that's happened to all of us, but for women of childbearing years, this is oftentimes due to our monthly cycle. And as we were digging into all the information about this, we really uncovered some interesting stuff. And I have to say that I learned a lot just from putting together Allison doing most of the research here and educating me about some of these things. So if you have any questions throughout our presentation today, please leave a comment here. We'll try to answer questions if they fit into the part that we're talking about in the conversation, or at the end, we'll be able to address comments. And we'll also be adding a list of resources to the post after this is done. So we are talking about why our blood sugar levels change each month, what we can anticipate, and possible ways to compensate for those blood sugar level insulin resistance changes that we're experiencing. So we're going to be talking about, well, I pretty much just said that. What causes the blood sugar shifts? What are the most common patterns? How to adjust insulin? What about perimenopause or teenage years? Those are definite wild cards, I guess. Hormone replacement therapy, we'll be touching a little bit about that. Metformin, birth control pills, all sorts of stuff on the agenda today. And just like our protein presentation, I have a stack of notes here again. So I think I have 5 pages of notes here that we're going to be going through. So I am going to be referring down to my notes, and we'll get this going. But before we get into all of that, we have to introduce this wonderful lady who is sitting here, Allison Herschede. And instead of me doing the introduction this time, Allison, would you introduce yourself to everybody?
Yeah, I'm Allison Herschede, and I am a coach for diaVerge. I'm a registered nurse and certified diabetes care and education specialist.
Formerly known as CDE, or Certified Diabetes Educator. The name was just recently changed.
Yes. And I am a lifelong type 1 diabetic.
Fantastic. I was going to say, throw in some history of yours there. So we are both type 1s. You were diagnosed as a toddler.
18 months, yeah.
And I was on the other end of the spectrum, diagnosed in my early 20s. So let's see, I'm Lisa Lanasa. I'm the founder of diaVerge Diabetes, and I started writing about my own experience of finding low carb, and really diaVerge was born out of sharing my experiences and people coming to me and saying, hey, can you teach me what you're doing? I want to learn this. And so we do focus on low carb diabetes education, but this is really applicable to everybody, or every woman with diabetes, because it's our hormones that are affecting our blood sugar levels in this case that we're going to be talking about today. Now, before we even get into all the details of it, as Allison and I were talking about how we're going to kind of lay out this presentation, one book came up for both of us talking about, well, it really boils down to knowing our bodies and knowing our cycles.
Yeah.
So, Allison,
it was funny because we both said it at the same time.
We said it at the exact same moment. So, yeah. Allison, this book is
Taking Charge of Your Fertility.
And it is the 20th anniversary edition of Taking Charge of Your
Oh,
Fertility is
that makes
out.
me feel so old.
And it is by Toni Weschler. We will be putting an Amazon link in for anybody who is interested in it. But this, I attribute this book as just as big of an aha moment for me as Dr.
Oh,
Bernstein's book was. So both of those books were just absolutely
absolutely.
life-changing with
Yeah.
how all of the information I knew about how my body functioned. So, and I was screaming, well, virtually screaming in my head after both of them saying, why didn't anybody tell me this
Right.
beforehand? I didn't know any of this. So if you are just starting to learn more about your body, if you want to learn more about your cycles, we will be kind of referencing some information from this book throughout our presentation.
And it's not just if you're trying to get pregnant, it's
true.
Any woman, whether you're wanting to avoid getting pregnant, whether you're just wanting to learn about your body. This book is like so full of good information.
Yes, absolutely. I completely agree. So I have to throw that out there before we even get started. So now the big thing, the big message throughout our research that you have done in the past week or two here in preparation for this is that our blood sugar swings are not just because of progesterone. So we have lots of other things.
That surprised me. I thought it was just progesterone, so I have learned a lot.
Yes, I also thought it was progesterone. You know, your blood sugar levels go up in the last week of your cycle, and that's all because of the progesterone release. But that is not. It's true,
well,
but it's not.
Progesterone's a heavy hitter. It's the big one, but it's not just the progesterone.
Yes. So, we have somebody saying they just logged in and missed the name of the book. It is called Taking Charge of Your Fertility by Toni Weschler, and I will be putting a link in the comments afterwards. So, based on what we just said about not just progesterone, let's walk through the stages of a standard cycle, if there is such a thing as a standard cycle, and just talk about what's happening at each stage and what the hormones are that are influencing our insulin resistance. So
go ahead. Sorry.
I was just going to say, so if we start off, our cycles actually start with day 1, and that is actually when our period starts. So normally, you know, from day 1 to day 5 or so is the actual, you know, period. And then after that, jump in here at any time, Allison. After that, we are in the follicular phase.
Follicular phase
was tough for me. And what is happening in that?
So the follicular phase is actually the first 14 days of the cycle, so including your period.
Okay.
During the follicular cycle, your hypothalamus in your brain is telling your pituitary gland to release this hormone called follicle stimulating hormone, or FSH. And that's going to make the ovaries produce these follicles. So these little cysts with little baby eggs in them, immature eggs. So when these are produced, that tells the body to produce more estrogen. So we have our estrogen going up, we have our FSH going up. And when that estrogen goes up, it causes a release of LH, or luteinizing hormone, which is what, if you track your ovulation using those little tests you can buy at the dollar store, the ovulation predictor kits, that's measuring for a LH surge of the luteinizing hormone. So all these things are going to peak at ovulation when your body releases an egg. And that's where, at this point, we're going to see a spike in insulin resistance. We're going to see higher blood sugars briefly during this ovulation period.
And the information that we are finding said, you know, maybe 2 to 3 days at that point, at the point of ovulation, you might see higher blood sugar levels. And then what happens after ovulation?
So we have a little brief reprieve.
Yay!
Where things are, and then we're going to start seeing that insulin resistance start to increase as the progesterone levels are rising and the estrogen levels are falling. So yes, progesterone is the heavy hitter. And those of you who've had a baby before may have noticed in early pregnancy, maybe when you first found out before you had any symptoms, you saw you were high all the time. And that's often one of the first symptoms in a diabetic that they're pregnant is these horrible, they're fighting highs and insulin's like water, and it's this horrible insulin resistance. And that's because of those increased levels of progesterone. So it's basically the progesterone is high just in case there's a baby because it's needed to support a pregnancy. Right. So we've got these high levels of progesterone, and then the week before your period, you're seeing a lot more insulin resistance.
And that's when most people notice it. That's when most people are like, oh my gosh, okay, this is when my blood sugar level's up. And maybe that's because of the length of time. Like we said, at ovulation, it's just a very short amount of time that most people experience some highs, and, you can barely adjust for it before it goes back down to normal. So, a lot of people, I think, miss that time.
Which is why tracking is so important, and learning your body, following the steps in that book so you can learn when ovulation is happening.
Yes. And if you're just joining, I'm going to mention that book again. Right at the beginning, we mentioned Taking Charge of Your Fertility. It is on its 20th edition, or 20-year edition. 20th anniversary. Thank you. Edition now. And it was a really life-changing book for both Allison and for me. As we discovered this, I discovered it maybe 12, 13 years ago. And I was saying it was just as influential in my life as Dr. Bernstein's book. Both of those totally changed how I viewed my body and the control, really, that I had over my body. Once you understand something, you can really work to, take the steps to kind of control what's happening.
Just most women are in the dark about what's going on. They know when they get their period, and that's about it. They don't know what's happening and when. And it's just so eye-opening to learn exactly what's happening.
Absolutely. And now the book that we mentioned, Taking Charge of Fertility, talks to you about different bodily clues that you can use to track your cycles. And so when you're ovulating. It also has charts in there that you can use to track your cycles. But you and I have both used apps for a while to do this, correct? What do you use?
Yes. I use Kindara. It's Kindara, and I've been using it forever and ever. My 15-year-old daughter uses Clue, and I think Clue is a lot more popular, but just because I have 60-something cycles in Kindara, I haven't switched.
I use Clue. I love it. It gives you some predictive, you can sign up for predictive notifications, which is great. It's a little creepy, though, when it says, okay, your cycle's about to start. So that's really interesting.
And you can also, I'm told, add notes. Alex Quinn was talking about that, how she puts in notes about what's happening at what period of time in her Clue.
Oh, so that's fantastic.
We may need to add a unit of insulin. We may need to increase our basal here,
Oh, that's wonderful.
To give you an idea, yeah.
Okay. So let's see. So we talked about period trackers. We talked about being able to, learn some of the signals that your body is giving to be able to track your cycles on your own if you don't want to use an app.
Oh, and the other thing, that I just thought of that we missed is once you actually start, you're going to see a drop. You're going to see a drop in the insulin resistance. You're going to become much more sensitive and probably see a lot of lows.
So once your period starts, you're coming off of this time of higher blood sugar levels and usually, higher insulin to adjust for that. And then for me personally, it's day 1 of my period that my insulin needs drop off and I have to go
and for me,
dial way back.
Day 2. So this all varies. This is not like a solid, this is the template for everyone.
Right.
So,
but the point is,
the most common,
the point is to know your body, track your cycles, and really make note of what's happening in the different times so that you can recreate it next month or adjust for it next month. And, a lot of people are really period negative, I guess. And I always see it as another opportunity to get it right. So I always look at it kind of like, woohoo, okay, let me try this again. This is... or make some adjustments that I didn't make last time or something. So I don't know, maybe I'm a little funny that way, but that's okay. I don't take myself too seriously, so I can always
that's always good.
Do that. Okay, we do have a couple questions here, so let's just get these questions answered before we have too many here. But let's see. One question is, oh, we're going to be addressing this one in just a little bit. What happens when you have a hysterectomy? How can I know what part of the cycle I'm in? So we will
Oh, that's a very good question.
That's an excellent one, and I think we have some good firsthand experience to talk about here.
Yes.
And then, what's the hormone that causes the drop after when menstruation starts? Do you know that one?
I think more of the drop in progesterone.
Okay, so that just
and the
keeps
rise
kind of
of
dropping.
Yeah.
Okay. That makes sense.
It's not one causing the drop, it's the absence of it.
Okay, let's see. So I'm just scrolling through, seeing if there's anything else right now. And for anybody else who has questions, please leave a comment and we'll try to answer them whenever we can. Okay, so now with tracking, of course, that's always easiest for people who have regular cycles. And if you don't have a regular cycle, it is certainly a little bit harder. But what we keep going back to is the book, meaning in this case, not Dr. Bernstein's book, but this Taking Charge of Your Fertility book. And you can use some of the bodily clues that book teaches you. We can't really go into all of that here. That's another whole topic. So we highly recommend the book Taking Charge of Your Fertility so you can know some of these bodily clues and you can anticipate your cycles a little bit better. Okay, so now going into insulin a little bit. So we know a little bit more about what's happening in each phase of our cycles, what's happening as far as the hormone levels, where our insulin resistance might come into play. Now, what are some of the strategies that people might be able to take to adjust their insulin to combat these highs that they might be?
If you're on an insulin pump, you can set a different basal profile for this period of time, and that's what I did when I was pumping. I had an increased basal all around, increased my correction factor. I needed more insulin to correct a high, more insulin to cover my carbs. So I would set that profile in my pump.
So that's good to know. It's not just basal for many people that need adjusting. It's both the basal and the bolus, the food boluses and corrections that need to be adjusted as well.
And if you're on MDI, you can increase your basal insulin. A lot of us find a unit or two. Some people need more if you're more insulin resistant. For me, it's usually a unit, 1.5 units, maybe 2 at the most, that I'm increasing my basal.
That's good to know. It does depend, of course, on the person. Like we said earlier, this is not an across the board, these are not recommendations that will work across the board, but we really have to figure out what works for us personally. I use Levemir, and I usually increase 2 out of my 3 Levemir doses per day. So that is how I deal with it.
Just started back on Tresiba, and it's actually going well this time. I think I've got it figured out, knock on wood. And I've just increased that by a unit right now. I'm in the insulin resistant part of my cycle right now, so I've gone up a unit, and it seems to be working. I still have a couple kinks to iron out, but not too bad.
That's great. And now, before we got on this call, you and I were chatting just a minute and saying that you are experiencing faster changes when you change Tresiba, because when I used Tresiba, it would take days to see any sort of a difference, and it was really frustrating.
Right.
And so I was saying that for adjusting for your cycle, Tresiba might not be the best because you can't adjust fast enough in many cases.
It's definitely easier when you're splitting. With the Lantus, I could, take more or less morning, night, and it was in and out of my system faster. So you're absolutely right that the shorter acting basals are going to be easier to adjust.
But you're having pretty good luck with adjusting the Tresiba at this point.
So
that is great. I love to hear stories like that because it just shows that we are all different and different things are going to work for different people. So I love that. Now, I know some people say for pumps and for pump adjustments, people might go to 120, 130% for the luteal phase or the second part of the luteal phase.
Right.
and then maybe 90%, they go step it way back to 90% or so. That might be a spot where you can start at and adjust from there.
Yeah.
But
This
it
is not one
definitely,
size fits all.
no,
But yeah, that
certainly
is a
not,
good
certainly
starting
not.
point.
And then I have talked to other people too who are using a pump with a manual or an auto mode, excuse me, using a pump with auto mode, and they
That's a
always
good
wonder
idea.
how to handle it because auto mode can't really keep up with some of the hormonal things that are happening at that point.
Right.
And we've talked about possibly going off of auto mode during those times so that you can manually,
Right.
make the adjustments that
And I
you
know a
need,
lot of people
because
don't like to do that, but that's the only thing I could personally come up with so you can manually make those adjustments.
and realistically, it might just be for 5-6 days out of the month, maybe,
Mhm.
or up to 9 days, I suppose. If you
Right.
take that last week of the cycle plus the first couple days, it's not the best thing, I suppose. It's not the easiest thing to do, especially if you're used to auto mode, but it certainly is one way to do it. So, okay, let's see. Moving on here. So let's talk about some of these harder times, perimenopause and teenage years, and some of the challenges that those times can bring to women. So let's see. One question that we had was about hormone replacement therapy. And how would you handle hormone replacement therapy, or what does that do to your cycles
Well,
or your
just
insulin
going
resistance, I
from my
suppose?
own personal experience, from the question before, I had a hysterectomy about a year ago in August of 2019, and I kept my ovaries. So it's definitely harder to track my cycles, but it is doable. Um, Lost my train of thought for a second.
Oh,
But I did find that my progesterone had tanked, and this, I don't know if this is the case overall for everybody. I also had ovarian cysts, and they had removed the cysts from my ovaries, so that kind of may have put my ovaries on hold for a minute or something. But anyway, point is they put me on progesterone. And during the time I was taking the progesterone, cycle days 12 through 28, which is hard to figure out when you don't have a cycle, I'm taking the progesterone, and it's definitely, I can see the insulin resistance, and I need to adjust my insulin when taking the hormones, just like I would with a normal cycle.
Okay. Well, that's good to know, because I think that's a huge question mark in a lot of people's heads. Like, well, what do I do?
Right. And I don't know if you wanted to touch on that tracking the cycle question, but what you can do is you can still do the ovulation predictor kits, because you're still going to see if you're making the LH surge. You can do the basal body temperature that's mentioned in the book, where you're checking your temperature first thing in the morning before you get out of bed, so you can see the spike of your temperature when ovulation occurs. And then there's other things you can, I personally will feel a little pinch on one side or the other when it's happening. I break out, my chin breaks out when it's about to happen. So there's little things you can pay attention to figure out at what point in your cycle you are.
Yeah, and that is all when ovulation happens, correct? Right. Okay, that makes sense. And it goes back to knowing your body and knowing the signals for ovulation, which is a big step in really figuring out all of these adjustments that need to happen. Now, another question we had is, well, I suppose talking about teenage years, teenagers generally have more erratic cycles, and all of these things can definitely apply to teenagers as well.
Oh yeah.
That's
one of the toughest points in diabetes, I would say.
Teenage years.
Yes. Just in addition to the whole rebellion, and I want to be like everybody else, you've got the raging hormones, and you've got the unpredictability of the cycles.
And now let's talk about birth control pills and the impact that birth control pills have on our cycles, and what Dr. Bernstein says about them.
So yeah, Dr. Bernstein will put his patients on pills. And a lot of people are happy with this. What it's doing. Did I lose you? Okay. Because it's going to make everything level. So you're going to be getting the hormones, the estrogen and progesterone, but it's a steady dose. So it's the same all month long rather than this, roller coaster of hormones. So I personally didn't like them. I don't do well on hormones. I turn into a crazy psycho on hormones. I get all kinds of side effects. And I saw that I was, insulin resistant, throughout the month when I was taking the pills. And some people are okay with this because they know they can adjust their insulin. Just to cover that, it's going to be more level and predictable.
And yes, and having more predictable cycles can be really a benefit to people who have very unpredictable cycles. So in that respect, they can be a very good thing. Now let's see, what else do we still have to cover? I don't know. We're blowing through some of these things.
We have not talked about metformin.
Oh, metformin. Yes, absolutely. Talk to us about metformin, Allison.
Well, Dr. B is a big proponent. He uses it with his female patients. He uses it for basically everybody. Well, he likes the glucophage, which I heard was off the market, so I don't know. But I use metformin XR myself. And you can use the metformin. I just use it for the second half of my cycle, just in general. You can take it during that last week if you want. You can, whatever works for you. Some people take it all the month, the entire cycle. Right. I have found it helpful. It's not a miracle pill, but it can help you to take less insulin and to have less insulin resistance than you would see prior. And even with the teenagers, with the perimenopause, every menopause, I recommend metformin. It's one of the oldest and safest drugs out there, and it has all these benefits. I know there's been stuff in the news lately about recalls, but if your metformin is recalled, your pharmacist will let you know. So
now, just one question for you, because metformin extended release is not available in all parts of the world. So I know that is generally preferred because it's easier on the stomach. Well, for one of many reasons, but would a standard metformin work as well, or would that not really?
Definitely.
Okay.
It's better than nothing. And you're going to want to take it on a full stomach. Don't take it on an empty stomach. And honestly, what I've seen and other doctors I've spoken with, people who eat a lot of carbohydrate are going to have more GI gastrointestinal issues with metformin. And the low carb people don't have as many issues. So that's another plus for low carb.
Oh, that's fascinating. I want to do some digging into that. I love that. Okay, well, thank you. We also have a whole list of resources that I said before we will be posting in the comments here afterwards. We do have another question here, so I wanted to just address this. Does PCOS play a role in the cycle and predictability in swings with the cycle?
Oh, yes, absolutely.
If you're not...
PCOS, sorry, go ahead.
Oh, and then the question continues a little bit, but I wanted you to just address that. So it definitely plays a role in the cycle and the predictability or unpredictability.
Yeah, one of the main symptoms of PCOS, which is polycystic ovarian syndrome, for those who aren't familiar, is that you have unpredictable cycles. Some months you won't ovulate. And low carb and metformin. Those two things are the biggest recommendation I can make for PCOS. Because I personally have PCOS and I was able to basically reverse it. I got pregnant with all 3 of my children while following a low carb diet. The first 2 were accidental. I was doing Atkins to lose weight and I didn't notice the correlation until years later. Like, I was doing Atkins when I got pregnant. And I had gone for 3 years. Yeah, I had gone for 3 years, no birth control, and wasn't getting pregnant. And I thought I couldn't get pregnant. And I get on Atkins and bam. So
amazing how things happen.
Baby number 3, I was permanently low carb, and that's when I got pregnant with him. So it can. So what happens is you're taking more insulin. You're becoming insulin resistant with PCOS, with the high levels of testosterone. You have high testosterone, you have high insulin. So if you lower the carbohydrate, and then metformin helps with this as well, you lower the insulin. You lower the insulin, you lower the testosterone. So ovulation is happening more. It can really, really help regulate things. I've seen people who haven't had a period in 2 years do low carb and they start becoming more regular.
Oh, that's fantastic. And you addressed the second part of the question there. So what is a possible treatment?
Okay.
Should PCOS be addressed? Perhaps the best way is low carb anyway, the comment suggested. So yes, low carb can certainly help with that, as Allison had.
And I've seen so many stories and just doctors recounting. My own nurse practitioner, Dr. Bernstein, talks about, his own patients who he starts them. So, I lost you for a second. Okay, I think we're okay.
We're cutting out a little bit here, but I'm hoping the recording is catching us more or less. So that is the gist of what we wanted to talk about today. Certainly, if you have any more questions, add them to the comments section. Oh, we're just spectacular. Thank you, Karen. We appreciate it. We're here to help. We want to tackle some of these bigger topics and talk about them in a really easy to understand sort of way from personal experience and from your medical experience, Allison. And so we're just really happy that what we're doing is helpful to people. So as always, we do have to caution you that everything we talked about is not a one-size-fits-all. There's not some law that this is how you have to adjust your insulin for hormone levels. We suggest tracking your cycles, testing various strategies to adjust. Certainly looking into metformin or birth control pills if you believe that one of those is appropriate for you. And then, of course, reviewing your personal results and making changes. I think so much of diabetes management is taking the data that we have in front of us and being able to make adjustments based on our data.
Something else I wanted to throw in, because I remembered someone had asked a question about how you get your endo to prescribe metformin, because a lot of them are very anti-metformin for type 1s. They'll say that's just a type 2 medication. Definitely, if you have PCOS, metformin is a known treatment, so you can absolutely use that to convince them. And then I think showing this pattern, using your Dexcom readings to see, okay, you can see right there where I'm becoming insulin resistant, and showing the numbers that are happening throughout the cycle, I think would also be helpful in showing the endo to maybe convince them to use metformin.
And sometimes people can find that their general practitioner or
that was my next thing. Yeah,
ask a little bit more
primary care doctor
to,
if your endo won't do it. That has been my best.
Many times those primary care doctors are more willing to try different therapies. So that's certainly an option. And other people do have to know that if they're not in the United States, it might actually be easier to get some of these things. I can get all of my prescriptions without prescriptions. So
nice.
Which is, it's good and frightening in some respects. But anyway.
Right. Yeah, that's true.
I can walk into my pharmacy and just pay over the counter for everything. But anyway, that's another whole topic. But metformin might be more available for people who can do things like that, because I can go into my pharmacy and order what I want. So, so thank you to everybody for joining us. Once again, whether you're joining us live or the people who are joining us in our recorded version of this, that's going to be living on the diaVerge page. If anybody wants to, you can go through this video again and, pick out other little bits of information. We are around for questions. And we also wanted to bring just a quick little note that Allison does personal coaching. That is what Allison is doing. So if you guys need more personalized help, Allison is the person to go to. She is amazing and is so knowledgeable both about low carb and all of the medication adjustments. She can legally help you with all of those medication adjustments that need to be made, and and get you to where you want to be as far as your blood sugar control goes. So we do have, I don't know, I don't want to say a bit of a promo, but it's a little extra bonus. If you sign up for Coaching with Allison this month, we're offering an additional 45-minute coaching call, which would be added on to the end of your coaching package. So I'm going to be posting some links about that within the comments here. And you have 1 week left in the month. So if you want to take advantage of this extra bonus, you have a week to get this all signed up and going. And certainly if you have any questions, contact me. I am the person who is, in the diaVerge page all the time, or Allison, and she has her own coaching page that she uses, and we'll be putting all the links in there, like I said. So thank you everybody for joining us. We are so excited to bring you this topic again, and we'll be joining you next month with another topic. And we have not decided yet on what that's going to be, but I'm sure we'll come up with something. If you've missed some of the other presentations we've done, we talked about protein last month. We've talked about pregnancy myths. We've talked about, there have been a bunch of them. I can't even remember some of the earlier ones. I know some of it was about overeating and strategies to avoid overeating. Yeah, some things like that. So go back into the diaVerge page and you can see some of those other presentations we did. So thanks everybody. See you soon. Bye.